The Ministry of Health has now mapped 22 of the 47 counties that are considered at high risk of the Ebola virus disease, as Ugandan authorities reported up to 23 deaths in just 1 week. Speaking at a stakeholders forum to discuss contingency measures in response to the ongoing outbreak in Uganda, the Director General of Health, Dr Patrick Amoth, has however assured Kenyans that the government has put in place adequate measures to control and manage the Ebola virus disease in Kenya. The ministry has increased surveillance and screening at border points, whilst asking citizens to be vigilant and report any suspected cases immediately.
Exactly a week after Uganda declared the first Ebola death, the cases have surged with a total of 23 deaths reported, registering an alarming case fatality rate of 64%. The Ministry of Health in Kenya is not taking any chances. It has developed a contingency plan intended to serve as a guide for the Ebola virus disease prevention, preparedness and response.
Surveillance efforts are in top gear, and everyone, if nothing is being left to chance. We were preparing also to make sure that everyone who is going to respond to the pandemic has the right tools at the right time, so that we also don't lose healthcare workers.
This time the outbreak is closer to us, and therefore, owing to these risks, we are implementing effective measures to ensure that we stop, one, the importation of the outbreak into Kenya, and two, if it does happen, then we put into place control measures.
The government has formed an Ebola virus disease multidisciplinary task force tasked with identifying high-risk factors for Ebola introduction into the country through updated risk assessments, as well as to boost capacity at the points of entry for detection of suspect Ebola virus disease patients.
20 out of 47 are at risk. Of course, the entire stretch bordering the Republic of Uganda, all the way from Turkana in the northwest to Migori in the southwest. Then the line stretches all the way from Busia along the A104 highway up to Mombasa. So all those countries marked in red are potential hotspots, and probably that is where we would be able to get the first case.
The task force has identified and listed 20 counties considered to be hotspots. The counties are Busia, Nakuru, Kiambu, Nairobi, Kajiado, Machakos, Makueni, Taita Taveta, Mombasa, Kwale, Kericho, Bungoma, Siaya, Migori, Homa Bay, Kisumu, Trans Nzoia, West Pokot, Turkana and Uasin Gishu counties. Members of the public residing in the border areas are encouraged to report any visitors passing through the informal routes into the country to the local administration.